Hello and welcome back to another episode of the Get Smart with Your Heart series. This series is an initiative of Integrated Health and Wellbeing Council and is being kindly powered by Boehringer Ingelheim. This is a World Heart Day Awareness series, and throughout this series, we have been discussing on various topics related to awareness around cardiovascular health. This episode, we would be talking about the topic of elevating cardiovascular care for seniors, strengthening the NPHCE program for aging population, for which we have eminent set of panelists here with us. Please allow me to welcome Dr. Urvashi Prasad, who is director at the VC office of Niti Aayog. Ma'am, welcome to the show. Thank you so much for joining.
Thank you. Thank you.
I welcome Dr. Pankaj Manoria, who is Senior Cardiologist and Director of Manoria Heart and Critical Care Hospital from Bhopal. Sir, welcome to the show. Thank you so much for joining.
Thank you very much.
With that, let us discuss on this topic. So the session aim is to raise awareness about the unique cardiovascular needs of elderly individuals and the role of National Program for Healthcare for the Elderly, NPHCE, in addressing these needs. So my first question is to Dr. Prasad. Ma'am, can you please inform our audience a little about the National Program for the Healthcare of the Elderly? What all does it cater to? And what all different activities that the government are doing in order to improve the healthcare for the elderly, focusing on cardiovascular aspects as well? Over to you.
Yeah, thank you. Thank you for the question. I just want to, start by saying that while we are talking about the elderly, ultimately, an issue like cardiovascular disease, we have to address it, throughout the life cycle of a person. Because ultimately, what you do in your younger days, what happens to you in your adolescence, what happens to you in your middle age, a lot of that will determine, what then diseases or conditions you develop, when you become older. So in terms of the approach, that we have to these issues is to look at it as a continuum, because ultimately, if you look at cardiovascular disease, it is associated with behavioral factors, right? Like smoking, alcohol use, low physical activity, insufficient vegetable and fruit intake. In the Indian context, poverty, maternal malnutrition, early life changes, they enhance, somebody's risk of getting cardiovascular diseases, right? So we have issues like, rural to urban migration, that happens in distress, and it leads to overcrowded and unclean, environments in urban slums. And there are problems of inadequate, housing, indoor pollution, infectious diseases, inappropriate diet, etc. So what I'm trying to say is that increasingly in our government policy, we are looking at it, as a continuum issue, as a multifactorial issue, that we have to address the multiple determinants of, cardiovascular disease. We have to address it right from, the early stages of the life of an individual. And very importantly, we have to address the gender differences, right? Because, men and women, also, if you look at the data, there are differences in terms of their propensity to get cardiovascular disease, as well as to, in terms of mortality from cardiovascular disease. And there are very important state level differences. So that is also something. These are kind of the four macro things that I just want to highlight that we are bringing into our policy, and we are focusing on. And a particular area of focus, and I'll stop after this and then we can go into more details later, is on the primary healthcare side. Because when you talk of cardiovascular disease, yes, for people who have advanced disease, there's a very different type of treatment and specialized treatment which is needed. But a lot of our focus is actually on prevention, early detection, screening, as well as monitoring. People who are, say, on regular medication, they are on antihypertensives or whatever that might be, monitoring such people and their conditions. So these are really very, very major focus areas, from a policy and government program point of view. So I'll stop here and then we can, have further discussions. Thank
you so much, Dr. Urvashi. Those were some very essential points that you highlighted. We will come back to you after taking a question from Dr. Pankaj. Dr. Pankaj, as Dr. Urvashi was describing, that there are various many factors that influence the quality of life that a person is having all throughout his life up to the age of elderly. And many of these stressors, which could be poverty or could be a rural-urban migration or could be general life stress, affects the heart health, particularly till the time they come into old age. So based on your extensive experience in cardiology, what are the unique cardiovascular challenges that you face amongst specifically your elder population that are not so evident in, the younger population, and how do you handle that population differently?
Okay, thank you. First of all, thank you for inviting me here. And I totally agree with Dr. Urvashi that whenever we see, it's not about taking measures at the older age groups, because if you see all these plaque formation or the blockage formation, it starts very early in the stage. If we have to take measures, we have to take measures very early, because it takes 10 to 20 years for that blockage to develop that appears as a case of a heart attack. So if we take measures, if we think that we are taking measures at the older age, then it's very too late. We have to take measures at a very early age so that we can prevent heart attack. To prevent heart attack, I always say it takes at least 15, 20 years for that attack to develop. So if you start your healthy measures or healthy lifestyle right from the day you think so, then only you will be able to prevent this happening at the older age. This is one aspect. And regarding challenges, what I face in this group of patient is entirely different from the younger group of. It's very challenging to treat these patients because of simple reason that they are very fragile and the chances of side effects of all these therapies are very much in these patients. So that is why we have to keep this in mind, the side effects of the therapies, and also the pharmacology and the pharmacodynamics of different drugs behave differently in older age groups. These patients have high bleeding risk. These are high bleeding risk for patients. So whenever we treat any cardiovascular disease in these patients, this is always in our mind that this drug, blood thinners, which we give in all these patients of cardiovascular disease, it can be a double-edged sword. They can cause increased bleeding. So we have to keep a balance between the efficacy of the treatment as well as keep in mind the side effects which can occur very frequently and very easily in these subgroup of patients. So all the therapies which I implement in younger cannot be implemented in older group. For example, there are various interventions which I do in this patient, but if the patient is very elderly, we sometimes don't intervene aggressively in these patients and put them only on medical therapy, because sometimes the chance of procedure is very high, risk of procedure is very high in these elderly patients, because in these category of patients, they also have multiple comorbid conditions, such as they have osteoporosis, they have some comorbid like benign prostatic hyperplasia or other old age problems. They have these comorbid conditions also. So whenever we treat these patients, what other comorbid conditions they are having, these should also be we should keep in mind when treating these patients. So it's really challenging this subgroup of patients, I can say.
Thank you so much, sir. We will come back to you with a few more questions around the topics that you highlighted in the discussion. My next question is to Dr. Urvashi again. Ma'am, there are many state level differences that you shared, and also as Dr. Pankaj shared, many of the cardiovascular medicines are very sensitive and very specialized to what they are providing benefits. So benefits versus side effects are very thoroughly evaluated, and specific drugs are then prescribed. And there is this challenge that we hear across from all sorts of elderly patients, or even people who are on a continuous cardiac care medication, that the drugs are really expensive for them to afford. And doctors also make sure that they prescribe only the generic names of drugs, so that the cost of the treatment does not exceed too highly. So how is the government helping in supporting such individuals, those who are in the elderly bracket, do not have a primary income, just living out of pension, etc., very typical elderly case, and are on expensive cardiac drugs? How can we see the government supporting such individuals? Can you please share something?
Yeah, so I mean, drugs, I think for all these kind of diseases where these are also chronic conditions, you need to have the drugs often for long periods of time, much like cardiovascular disease, cancer also, there are some very, very expensive drugs. So I think, of course, the government does try to provide subsidized drugs through, various programs that it has. Yes, of course, these are, the generic drugs mostly, but there are, a lot of programs through which, that is one channel through which the government, whether it's the Jan Aushadhi stores or, whatever other programs, there's a lot of programs at the state government level as well, which kind of provide these medicines. But I think broader efforts that we are trying to make, are in two directions. I mean, one is that we're trying to see how we can, better cover some of these chronic conditions and their treatment, through insurance. So that is something that, we are looking at, because, as you know, with Ayushman Bharat, we do have now this coverage, at least for the bottom of the pyramid, for inpatient care, right? But for people who are, either coming for outpatient care, or people who are on these kind of medications for chronic conditions, we are trying to see, how we can develop, more effective and better programs to help such people. And of course, the other thing that, we are investing in, government is focusing on a lot, is the research and development into coming up with drugs which are more cost effective as well, because we are otherwise very dependent on the imported drugs, or medications which, like you said, are very expensive. So we are trying to push that aspect as well, that let us manufacture drugs, let us do better research, development and innovation, so that we can come up with our own medicines as well, to tackle these conditions. So I think those are two very big areas that we are focused on currently, and also from a futuristic lens.
Thank you so much, ma'am. So that is very nice to know that government is doing all such efforts in the two biggest areas that are required, that is R&D and also insurance coverage. I am sure with those when this comes out, it would be of immense benefit to all our elderly population specifically. My next question is to Dr. Pankaj. Sir, as you were sharing that in cardiovascular care, the earlier detection is the best. It's not just that when you detect at the very old age when the incident has occurred, at that time it is very late. So what would you prescribe for a man, for example, in his middle ages, and he wants to keep on top of his cardiac health? What would be this first diagnosis, the precautionary diagnosis? What age would you recommend it to be, and then subsequently at what ages should they regularly get their heart condition checked?
I think if you see cardiovascular disease is a lifestyle disease. It's because of the changes, poor lifestyle, that these diseases happen. So correct age of implanting healthy measures, it is not 50 or 65th or 6th decade. It should be second to third decade. That means once you are 25 or 30 years, that is the right point. That's the right time to start healthy measures. Because what you do in this age of 20, 30 years, that will reflect or on the when you become 55 or 60. So that's why I always say start these measures early in the age. Then only you will be able to prevent these blockages from happening. As far as how to prevent, there's basically 5-6 risk factors which are responsible for heart attack. Number 1 is diabetes. Number 2 is high blood pressure. Number 3 is smoking. Number 4 is high blood cholesterol. Number 5 is stress. And number 6 is obesity. So these are 6 main risk factors which are responsible for heart attack. If you prevent these risk factors from happening, 90% of the chance you can prevent heart attacks. So if you don't have risk factors, try not to develop these risk factors. Or if you have these risk factors, it should always be try to make them under control. Suppose you have diabetes, then their sugar should be controlled, blood pressure should be controlled, everything should be controlled if you have these risk factors. But basic is try not to harbor these risk factors, and this can be done by applying these healthy measures. Diet plays an important role. I can say one formula I've prescribed to adopt healthy life. So that is a 6S formula. That means you have to say no to these things which start from S, like sugar, salt, number 2. Third is smoking. Fourth is stress. Fifth is saturated fats. And sixth is sedentary lifestyle. So if you avoid these things which start from these 6S, we can very well lead a very healthy life, and chance of developing heart attack or heart disease will be minimum. So these simple measures should be implemented, and the right time for implementation is when you're 25, 30 years of age.
Thank you so much, sir. So my next, and those are some brilliant steps that you highlighted, very crisp risk factors for our audience to understand, and also very crisp preventive measures that are your 6S. So definitely. My next question is to Dr. Urvashi and to you both. One by one, we will take it. We will be talking about improving the quality of life in elderly from a public policy level to Dr. Urvashi, and from a clinical point of view to you. So for Dr. Urvashi, we would want to know, ma'am, as Dr. Pankaj is also highlighting, as you have also been highlighting, that cardiac health is not just dependent on the health parameters, but also on the lifestyle that has been led all up to those years. That is stress and comfort of living being one of the very crucial elements when people experience pain or stress, heart pain due to stress, etc. So how can we have policies, or if we have any existing policies that are working in this, please highlight, that are working in not just improving the health parameters of the elderly, but also the overall general quality of life of people when it comes to which areas they are living. Do they have the means to earn, or do they have fresh natural spaces all around them to recreate, or are they having good work-life balance? And everything under the roof comes under this aspect. So can you please highlight some of the initiatives by the government that focus on not just improving health by curing their diseases, but overall providing a very good balanced and healthy life situation to the population?
Yeah, so I mean, I think just to firstly just further highlight the point that Dr. Pankaj was making. Just one statistic that in India, the mean age at which people get their first myocardial infarction is 53 years. So that is about 10 years earlier than their counterparts in developed countries, right? So this is a very big, issue of concern, that people in India are actually, getting the major cardiovascular episode at an earlier age. And And that's the whole point that we have been trying to make, that, what you do from your very early years in life, actually influences what happens to you. And it's not about waiting, till the elderly stage. So that's why, and also, as I said at the beginning, that we are taking a very multidisciplinary approach now. So all the things you mentioned, come in a multidisciplinary approach. So, we are looking at nutrition, right? We're trying to say that have a healthy, balanced, nutritious meal, or if we are promoting a grain like millets, right, where we are saying that go back to your basics. Our basic Indian thali is far more nutritious and healthy than the kind of junk food and the food that we are now prone to consuming, right? So nutrition matters, your stress levels matter, your sleep matters. Are you sleeping enough? That is very crucial, and a very, very important aspect of it. Are you exercising enough? As Dr. Pankaj said, that sedentary lifestyle. So we're trying to promote, we have had these things from centuries, right? Yoga, we have had it for centuries, that you should do yoga, you should do meditation. Now, this is not new knowledge. This is knowledge which has been around for a very long time, and we're trying to bring it back, into the Indian ethos and the Indian way of living, so that, we can be healthier overall. It's not about any one particular disease, but it's about having a better quality of life and better health from an overall perspective. Now, of course, there are many issues which are much broader, like you said, poverty, there's housing, there's pollution, so all of these, of course, there are different kind of government programs to address these. But ultimately, what we are doing is trying to use a public health approach to address this issue, and not a medicalized approach, because, like Dr. Pankaj said, we don't want people to come to a stage where they develop severe heart disease, where it is very difficult to treat them, it is very expensive to treat them, it is very complicated to treat them. So we want to, prevent, or we want to catch them at an early age. And for that, we need a public health, multidisciplinary approach, and covering all these elements. So that is what we're trying to now push in the policy space as well.
Thank you so much, Dr. Urvashi. My similar sort of along the similar lines, the question to Dr. Pankaj is, sir, while ensuring the good quality of life for the elderly, there are incidences that you must be experiencing wherein providing medical care for the ailment that the person is having underseeds the need for giving them good quality of life that they are already living. So while you are at the crossroads to choose whether to fix that particular issue in the very old group people, or to let their last years live peacefully and in comfort, how do you balance that? How do you choose in which situation what is required? And what would your suggestions be to all the budding cardiologists that want to know this understand this aspect deeper?
Yeah, I think you have raised a very practical question. If you try to implement very strict measures at that elderly group of age, when they know that their 2/3 or 70% of the life is already over, they sometimes feel frustrated, or they think, what's the use? That is why I always say a 80-20 rule for them. 80-20 rule says that 80% of the time you eat healthy food in the week, 80% time, and 20% time you can relax, you can eat food which are good for taste, for satisfying your cravings. So that keeps a balance. Got my point? 80-20. 80% of the time in the week you eat healthy foods, but 20% of the time you can just relax, you can eat some all these stuffs which we eat for taste sake, or for satisfying a craving. So in that way they don't feel frustrated also, and most of the time they are eating healthy food, so it keeps a balance. So this always I advise this 80-20 rule for a healthy diet. That keeps a balance. So this, I think, you have to them. Otherwise, basic dietary measures to adopt healthy heart. There are 4 principles of diet. First of all, we need to avoid, there are multiple fats available. The trans fats among that are the worst of the fats. So all these fats, all these food products which have trans fatty acids, these are the worst for heart attack, because these trans fats, they directly deposit in our coronary arteries, and can lead to blockages. So avoid trans fats. Number two, avoid those food which have high glycemic index. That means moment you eat these food, the blood sugar rises suddenly and then suddenly drops. So these are called the high glycemic index food. That means they raise your blood sugar very sharply. So that all those foods that should be avoided. Thirdly, we need to encourage foods which are rich in omega-3 fatty acids and monounsaturated fatty acids, such as nuts and these walnuts and all these fruits. So they increase good cholesterol, which is good for the body. And fourthly, we must increase fiber and antioxidants in the form of fruits and green leaf. So these all, if we implement these simple measures, try to analyze these, they can play a very important role in preventing attacks, heart attacks, or can lead to a very healthy heart for the patients.
Thank you so much, sir. I have another question for you before we move on to Dr. Urvashi, is that while we are advocating this 80-20 rule to the patients, what do you feel is the role of counseling for amongst the family members of the patient? And how do you encourage the family to, support the elderly? Because obviously most Indian families, how it happens is whatever is being cooked in the family, the elderly are also getting that food only, and the younger children are also getting that food, and everybody. So what would be the role of counseling the family members to focus on nutrition, specifically that as the adult, old age nutrition needs are very different from those of the young. And also looking at their heart conditions, they have to have these special measures of including these food items that you just shared. So how do you counsel those patients? How much efforts are required?
I think that is of utmost importance to counsel the family members, because it's a comprehensive effort which is required to rehabilitate these patients. Definitely, I do a lot of counseling among the family members as to how they can encourage them, because sometimes they become depressed also after having heart attack. So it needs a comprehensive efforts from the family members to motivate them to take that. Sometimes they don't take drugs also. So it's a responsibility for one of the family members to make sure that they are taking proper medicines, the compliance of the drug is adequate or not, the diet. The dietary factors also have to explain to all the family members that sometimes this diet has to be different from the others. So you have to take into consideration. So I think it's very much required a comprehensive effort. The counseling of the family members, the counseling of the patients, and everybody needs to be alert and to take measures. Then only we can get a good rehabilitation, cardiac rehabilitations of our patients. Definitely, I do that.
And sometimes the entire scenario is completely opposite. The family members are just too strict towards their elderly grandparents that, aapko ye nahi khana hai, aapko wo nahi khana hai.
That's what I said, that they become frustrated. If you took very strict measures, because that if strict measures they can apply for say 1 month, 2 months, 3 months, but at the end of 2-3 months again they're frustrated, they feel that they stop everything. That is why I say 80-20 rule. That's, you may keep a balance. Most of the time you eat healthy food, and sometimes 20% time you can relax. So that time, in that way, it satisfies your craving also, and it can be, that measures can be for a very long time we can implement these measures. That is why I say it's something.
Definitely, sir. And this technique is not just only restricted towards elderly, but you and me as well. People even in the young group should follow this, that if they are having, junk food, to just limit it to 20% of their entire diets or the entire week, and 80% of the times they should follow a healthier routine. So definitely applies to all population groups. But as my next question is to Dr. Urvashi, that, behavior change is so hard amongst the younger population that it gets even harder amongst the older population. And while we are advocating all these healthy measures to the, older population, there comes a time when, we need measures in which those are more targeted, so that we are, and we need to take help from the partnerships of private organizations, different agencies all together. So my question is to Dr. Urvashi, that what role do you believe partnerships play between government agencies, healthcare providers, and non-profit organizations for further strengthening efforts towards efficient care towards the elderly, more focused care, and also to elevate the cardiovascular care towards senior citizens of the country?
Yeah, I think, partnerships in any, especially, public health issue are absolutely crucial. And, this one is no different, because government cannot do everything, and that is never possible. Even during COVID, I mean, we were a country which was never used to wearing masks also, right? Because, you're talking about behavior change. We were never a country that where people were used to wearing masks. But then, during COVID, because there was such intensive, behavior change efforts, people, kind of became used to doing that. But of course, behavior change in this case has to be sustained, right? I mean, COVID was, it came and now we kind of feel it's gone, and so we're all back to our usual behaviors. But in the case of healthy lifestyle, and when you're talking about something like cardiovascular disease, which is all about long-term healthy lifestyles, then sustainability is very crucial. The behavior change has to be sustained, and that can only happen through partnerships. You need to have partnerships, you need to have civil society, you need to be partnering with the medical community, you need to be partnering with industry. Like I said, that for industry is very crucial for research and development. Industry is very crucial for helping us develop the right kind of technologies, that can do smart monitoring of senior citizens who have these conditions. Because anyone who has a chronic condition, they need to be monitored regularly, and technology can play a big role in that. So again, industry, private sector, startups can really help us to come up with those right kind of innovations for the Indian context. So I think everybody has a role to play, and unfortunately, the scale of something like cardiovascular disease in our country is massive, and even when we talk about it within the elderly, it's only going to be an increasing problem, because while we say that in India we are still a very young country, and we have the demographic dividend, etc., but actually, after the stabilization of the fertility rates, many parts of the country, especially like the southern states, there's already considerable aging which is happening. So our population of seniors is only going to increase. So we have to be really prepared to deal with these kind of issues at an even greater scale, and that is simply not possible unless we have a partnership amongst all the stakeholders.
Thank you so much, ma'am. My next question is to Dr. Pankaj. Sir, as telemedicine, remote monitoring, and artificial intelligence technologies are becoming increasingly relevant in healthcare, so how do you see these technologies benefiting the cardiovascular care of elderly specifically? And are there any specific technologies that you use in your practice that really help you monitor the progress, or just keep up to date with the health conditions of your patients who are in elderly age group?
I think telemedicine, telemonitoring, and artificial intelligence is playing a major role, and it is very helpful for these patients, particularly those patients who are living in remote areas, who cannot come, an elderly group of patients who cannot come again and again for follow-ups. And in that subgroup of patients, this telemedicine or teleconsultation, that is very helpful. And also sometimes in cardiovascular disease, these patients have irregular heartbeats sometimes. So what we do nowadays, we have a special device. We implant that device, which takes a continuous ECG monitoring for at least 7 to 8 days. We have that, or sometimes 15 days more. That device is also available. So the moment there's some change in the ECG or some change in the rhythm, that raises an alarm, and I get an email or on my WhatsApp message that this patient has got these changes in the ECG, so you can take. So this is a very very useful device. And also nowadays we have advanced ECG machines also in the periphery. The junior doctors or the doctors in periphery can do the ECG, and immediately the ECG reports comes to me, and with all the things I can guide them regarding the first line treatment which can be done in heart attack patients, because time is money in heart attack patients. Every seconds counts. So in that category, so in that sense, I can make a diagnosis very early, So I can start the treatment early in that patients. So before they reach to me, the basic treatment is already over. So these are very helpful. I think various artificial intelligence. I think various apps have been available now, and we have so much AI in cardiovascular things, which is a boon as far as treatment of these elderly group of patients is concerned.
Thank you so much, sir. So my next question is to Dr. Urvashi. Ma'am, when we look at the population pyramids of various countries, India's pyramid is the perfect, falls at a very good, level, wherein most of our population at the prime age, at the earning age group. But like every other country, the population pyramid shifts to, and varies. And it is predicted that in few years there would be more elderly population in the country, because all of them are right now at the earning age group, and they would graduate to the elderly population. So what all different efforts are required so that when this population reach the early age group, their health is also covered in a better fashion, as the government is investing in health a lot these days, since few years, and also really prioritizing on, as you said, R&D and insurance coverages. What other areas do you feel would require attention from both the practitioner side and the government side, so that we are giving good health coverage to our populations?
Yeah, so I mean, I think this I just covered in my previous response also, that population is now going through a transition, and we will have an increasing number of seniors in the population, and in many of our states, we're already, southern states especially, we're already seeing that aging sort of happening. So so I think that is definitely a big macro trend, that is going to influence a lot of sectors, not just this. So yeah, I mean, I think it is the same principles that still need to be followed, and it is still about starting early. It is still about focusing on general public health issues and nutrition and general quality of life, etc. But I think more specifically, we do need to better use technology, and definitely after COVID, there has been a big kind of acceleration of use of technology, whether it's telemedicine. Telemedicine is not a new concept, but suddenly after COVID, we saw that it picked up tremendously, and including in relatively remote areas, or rural areas, or tier 2, tier 3 cities, towns. So now we need to kind of just maintain that momentum. And that is where I said that partnerships between government, industry, startups, and of course the medical community, because they are the ones who can really tell you, what is the kind of monitoring we need of patients like this, what are the parameters we have to monitor. So all these, stakeholders need to come together and develop technologies which will be able to, really scale up in India's very diverse context. Because sometimes the problem with technologies is that, they only remain limited to some urban centers or, some larger hospitals. We need to make sure that we can take these technologies even to the most, remote, rural parts of the country, tribal areas, and we can provide, the benefits of these to patients everywhere. So I think that is really the big opportunity for us now, looking forward, is in terms of how do we better use technology. But I think other than that, we have to continue to focus on the basics. We have to have a public health focused approach. We have to strengthen our primary healthcare. We have to focus on early, detection. If you can catch somebody's hypertension, or you can catch somebody's diabetes at an early stage, it is always much better than if you catch it at a much later stage. So that is where our focus has to be, and that is where we need to focus, because our population is too large. We cannot afford to wait for everybody to develop a serious condition and, land up in a hospital. And then it'll be always be a big challenge, and it'll always be too expensive and too difficult, for the system to manage. So we have to focus on early, detection, prevention as much as possible, promotion of healthy lifestyles. And apart from this, of course, using technology, especially for people who have chronic conditions, for monitoring, etc. So I think those are really the areas we need to focus on.
Thank you so much, ma'am. So with that, we come down to the end of our very insightful discussion with Dr. Pankaj Manoria and Dr. Urvashi Prasad. I would like to thank both our eminent panelists for taking out time from the busy schedule and imparting wealth of knowledge and information. But before we part away, my very last question to both our panelists is the key takeaway messages for our audience as recognizing the World Heart Day and doing a week-long activity for raising awareness for the World Heart Day. Your key takeaway messages starting from Dr. Pankaj.
If you permit me, I propose a small poem.
Yes, sir.
Healthy heart.
Please.
Is it Hindi?
Please, sure. Yeah. No problem at all.
When this is through poem, I can want to give a message to all the audience how to keep a healthy heart. कि दो फेफड़े, दो गुर्दे, दो आंखें और दिल बेचारा एक, उसका ख्याल करके तो देख, छोड़ दे बीड़ी सिगरेट का नशा, कर देगी खराब ये दिल की दशा, थोड़ा वॉकिंग कर लो, थोड़ा वजन घटा लो, अपने ही दिल पे थोड़ा तरस तो खा लो, फास्ट फूड और फैट को कम करो प्यारों, वेजिटेबल और फ्रूट से जुड़ो ज्यादा यारों, शुगर और बीपी का तुम रखो कंट्रोल और बढ़ने ना दो अपना कोलेस्ट्रॉल, तो इन सब बातों का जो रखे ख्याल, उसका दिल रहे जवान सालों साल सालों साल. धन्यवाद.
Thank you so much, sir. That was amazing. Dr. Urvashi, key takeaway messages from your end, ma'am.
What can I say after that wonderful poem? I think Dr. Pankaj has really said it all. So yeah, I would say that you should follow everything he's saying there, and you should follow the 6S formula that he had given earlier. And really, I mean, I would just say it's about keeping things simple. Keeping things simple. Life is now very complicated. There's many distractions. There's a lot of things happening. So whether it's your diet, whether it's your lifestyle, keep it simple. Go back to the basics. Go back to a lot of knowledge that we have had for centuries. In terms of, I mean, these days I find on social media everybody's an influencer. Everybody's giving you advice. Everybody's telling you do this, do that, eat this, eat that. So I just say keep it simple. Go back to your basics, and of course listen to such great advice from qualified professionals and people in the field. So yeah, that is what I would say. Thank you for having me here.
Thank you so much. With that, we come down to the end of the session. Again, just to recap, the 6S formula of Dr. Pankaj is to avoid sugar, avoid salt, avoid smoking, avoid stress, avoid saturated fats, and avoid sedentary lifestyle. With that, I hope this session was just as insightful and informational to you as it was for us. Thank you so much. We would also like to thank our partner, Boehringer Ingelheim, for partnering up with us on this brilliant initiative of raising awareness around World Heart Day for Get Smart with Your Heart series. Thank you so much. And I would also like to thank all our audience for staying with us till the very end. Thank you. With that, we sign off now. Stay happy, stay healthy. Bye-bye.